Now, an overview of stem cells, a slide that I thought was very, very important, a quote that I saw by the founder of osteopathic medicine. He says, "The body of man is God's drugstore and has in it all liquids, drugs, lubricating oils, opioids, which is pain, acids, antacids, and every sort of drug that the wisdom of God thought necessary for human happiness and health. Man should study and use the drugs compounded in his own body." Well, we have stem cells, and stem cells are this untapped potential that we're now starting to tap into to really naturally fight pain and naturally build cartilage and collagen to help the repair process to prevent surgery and to help with pain. The stem cell, we run a clinic in Texas, in San Antonio, called the Stem Cell Orthopedic Institute of Texas, and we offer mesenchymal stem cell therapy and platelet therapy. These are viable options and procedures for people that are suffering from joint pain and tendon problems, or who may need potentially fusion of their back. The patient may therefore avoid a lengthy post-op period after surgery, which is often an invasive procedure and very expensive and requires a lengthy rehabilitation. In recent years, scientists and doctors have made tremendous advances in stem cell treatment. Through regenerative medicine, which is stem cells, a person can take advantage of their body's own ability naturally to heal themselves on their own, strictly on their own, through their own adult stem cells that can be found throughout the body. So essentially, it's the patient healing themselves. This may provide the patient an alternative for surgery. The stem cell is the Stem Cell Orthopedic Institute of Texas, our orthopedic institute that does injections for stem cell treatment. We offer this for knees, for hips, shoulders, low back, hands, wrists, and feet. Mesenchymal stem cells, again, which are the adult stem cells, are used for the treatment of osteoarthritis of any of these places, which we all have, and if you're viewing this, you probably have it. Rotator cuff tears, meniscal tears of the knee, tendon problems throughout the body, there's especially certain places, and spine disc disease. It treats a variety of problems, and we have to see whether or not the patient is a candidate for stem cells upon an examination. We all have osteoarthritis, which is the next issue that I want to talk about. And it was once considered only in the elderly, and now we're seeing it more and more in younger patients. Osteoarthritis can be a progressively debilitating and irreversible disease that affects mostly the cartilage and associated changes in the bone and synovium. Normally there's synovial inflammation, and the synovial area is the part that bathes the joints, inside the joints. And all joints can be affected with osteoarthritis, such as the hand, knee, the low back, etc. And some of the manifestations of this include joint pain, impairment to move, decreased range of motion, locomotion issues such as ambulating, and inflammation of the tissue surrounding the joint. And current treatments for osteoarthritis are really kind of limited, unfortunately. You start taking anti-inflammatories, and if that doesn't work, and physical therapy doesn't work, and injections don't work, sometimes people are prescribed narcotics. Mesenchymal stem cells, on the other hand, are isolated from the patient, and we inject them into the joints to see if this can be helpful for folks. Current treatment, as I said, in osteoarthritis is really used for some of the non-pharmacological treatments are used, and pharmacological treatments are used in early osteoarthritis, but protection of the articular cartilage has not been shown to be damaged yet. And then when it becomes a destructive process, then there's little else to be done right now except surgery. We think there may be some other alternatives for folks out there, such as mesenchymal stem cells. Total joint replacement can be successful for people for hips and knee replacements, resulting in enhanced mobility and reducing pain. And total joint replacements, though, include risks such as getting a blood clot, infection, increased costs for hospitalization and rehabilitation. On the other hand, mesenchymal stem cells have had therapeutic effects in osteoarthritis through some of the things that they secrete that are anti-inflammatory for pain, and some of the processes that they secrete as well that are called immunosuppressive, where they decrease the destructive process or autoimmune process of the body for that particular body region. Where are stem cells found? They're found in bone marrow, they're found in fat, they're found in synovium, they're found in blood vessels, they're really found all over the body. There's such things called pericytes, which live on all our microvessels, and pericytes on all the microvessels, which are the circulatory system, they eventually grow into and become a mesenchymal or adult stem cells when needed. There's different types of stem cells that I want to talk to folks about. There's something called autologous stem cells, which are our bone marrow stem cells, where we get at our clinic the stem cells to put into your joints that may be hurting. And then there's fat stem cells called adipose stem cells. And unfortunately, they have not proven to be nearly as effective as the bone marrow stem cells that we're using. There's also something called allogenic stem cells, which use the umbilical cord. We don't use any of this. We don't use amniotic stem cells, we don't use embryonic stem cells, and we don't use synovial stem cells. We use strictly bone marrow stem cells. Certain stem cells, there's different types of stem cells, like I said, but bone marrow stem cells have the best potential to regenerate bone and cartilage. There's a difference between the types of stem cells. I'm going to mention this now because I think there's some ethical issues involved for adult stem cells versus embryonic stem cells. Adult stem cells exist in all tissues. Embryonic stem cells only exist in the early development stages of the body. Adult stem cells are not considered cancerous, where embryonic stem cells, if injected, do have a possibility of potentially causing cancer. And the reason for that is they don't stop growing. They have a tendency of, when you put them in, they keep replicating and replicating. One of the beauties of mesenchymal or adult stem cells is they have something called contact inhibition, where they rub up against one another, and that's their motion right there to stop growing. That's their trigger to stop growing. And that's what we found to be very effective, and scientists and other physicians throughout the country are using it for this, to replicate and regenerate cartilage and bone and tendon. There's no immune response with adult stem cells, and there is potentially an immune rejection where your body ends up attacking itself with embryonic stem cells. And obviously there's less ethical issues about us using adult versus an embryonic stem cell. Function of stem cells. Stem cells do, I'm going to talk about this. I'll try to be as relevant and as concise as I can, but the power of stem cells is really, really something else. These cells that we take out of the hip, where we extract from a bone marrow biopsy, have the ability to secrete various what they call cytokines or enzymes that can do the following. They can cause an anti-inflammatory release, which causes decrease in pain. They can differentiate. This is mesenchymal stem cells, where they can undergo a differentiation into bone, muscle, and cartilage. This has been the greatest use for cartilage repair in orthopedics. They can secrete growth factors that increase blood vessel growth and nutrition to the growing cartilage. And they can increase collagen, and collagen is what makes up tendons. So if somebody was to have a rotator cuff tear or a tear in their what they call their knee area, their patellofemoral area, or their Achilles tendon, these are where stem cells and/or something like PRP, which are platelets, can be highly usable. They can regenerate. Stem cells can regenerate. They can protect the body from the death of injured cells, and cells that get injured take place in us all the time through injury, and when there's not enough blood vessel growth or nutrition. Stem cells also migrate to areas where there is an injury. And so these stem cells are much smarter than we ever thought. And so first we find out about them, and now we're using them, and we're finding all these different functions that they're capable of using. They're pretty amazing. They are mini drugstores. And again, they can be used for osteoarthritis, tendon repairs, meniscal tears, and rotator cuff injuries, along with all joint inflammation and arthritis. Stem cells are found in all joints. And all joints, and they're found in bone, and they're found throughout our body. Mesenchymal stem cells also help with tendon injuries, acute tendon injuries, chronic tendon injuries, and they help the healing tendon repair. When a tendon, such as a rotator cuff tear in the shoulder, or really anywhere in the body, gets injured, there's scar tissue can develop over time. You can have fatty infiltration come into the tendon, and you can have a disorganization or scar tissue take place that really causes a tendon to cause you to lose your range of motion in your shoulder, among other places. Mesenchymal stem cells injected in the tendon can increase that collagen fiber density. So we're actually giving the tendon medicine to help grow naturally. They can also produce a better organization of the collagen from an injury rather than just the scarring. What we use to inject scars with either stem cells but also PRP initially, which is the platelets, are rotator cuff problems, Achilles tendon problems, patella problems in their knees, and tennis elbow problems are the biggest areas that we use for PRP. And PRP, as I said, are platelets, which we use as well, and we use them in tendons prior to doing stem cells. In conclusion, some of the functions of the stem cells, again, they promote vascularization, they promote cell proliferation, they promote the cell to differentiate in cartilage, bone, or tendon. They inhibit or decrease the chance of osteoarthritis progressing, and they also decrease the inflammatory response. The above literature in our medical literature indicates that bone marrow-derived mesenchymal stem cells for tendon repair are very safe, and they have the potential to repair tendons. There's some safety issues as well with stem cells. A large review took place with 1,800 people, 1,800 orthopedic patients who had stem cells, and a follow-up of up to 12.5 years. None of them showed any evidence of tumor growth. The FDA guidelines allow us, there's no federal guidelines against not using stem cells, and there's no guidelines for using stem cells, as long as we don't manipulate the stem cells that we take out of your own body or bone marrow. So we can take, without any problems, your bone marrow stem cells and inject them right back into the patient. And what we do, my colleague's going to talk about it in a second, Dr. Hall, about how we do the procedure for getting the stem cells.